Help me grow, fast or slow, as long as I know you're digging for gold. Help me learn, soft or stern, as long as I know you're digging for gold. Life's a movie, the ultimate trip. You should have been told you'd be digging for gold. Hello, my friends, and welcome to another episode of Digging for Gold. This is episode 66. And we got a great guest for you today, especially for all the husbands, boyfriends, and women out there, and everybody else. But you're going to learn a lot today about women's health. And I want you to, subscribe on YouTube at Dan.Goldberg, on Instagram at Dan.Goldberg, and you can also go to Spotify at Digging for Gold, and you can go to TikTok at Digging for Gold. That's it. So guess who we have? We have Melissa Lee-Agawa. She is an OB/GYN, otherwise known as a gynecologist and obstetrician, right?
Yes.
And she, see?
You said it right.
I know. I went to high school. So I have to tell you this. You have a very interesting practice. I've been to your offices with my wife, and it's phenomenal what you're doing.
Thank you.
And I would really like you to explain to our viewers and listeners, because the Spotify people, they mostly listen, and the YouTube people, they mostly watch, and the TikTokers and the Instagrammers, they're going to get a little snippet. Give us an idea about what you're doing and how you came up with the unique concept that you have.
So just a little bit about myself. I'm a board-certified OB/GYN. I've been practicing for almost 15 years. I know I don't look like it, right?
No, I thought you were one of my freshman students, actually.
That's part of the business, But I have a vast experience in treating women. So imagine me as your local OB/GYN. You come in for your annual visits, your pap smears, I deliver your babies, and when you need your uterus out, I'll take it out. I'll do all of that for you. I'm up all night with you, to deliver your babies. But I didn't feel like that was enough for women. There were some things that I saw that there was a gap where I would make my recommendations. I say, hey, I think you need this treatment, and I can go into the details of that if you like. And a year later, they come back and said, I didn't like the options that you gave me, and my problems are still there. So I didn't help them.
That's a bummer.
That's a bummer, right?
Yeah.
I as a doctor, I wasn't able to help my patients. So let's just give an example, okay?
Yes.
So bladder control in women is a big thing.
And men.
We can talk about men in the future, maybe another episode.
Yes,
but
we could.
Bladder control is a big thing. A lot of women have sort of normalized, like, okay, well, I'm going to pee a little bit when I sneeze. I'm going to pee a little bit when I jump. And you're never going to see moms at the trampoline park jumping. They're all on the sideline because
I wondered about that.
because they're all afraid that they might have an accident.
How about laughing?
Absolutely. So a patient comes to me, and if they don't feel embarrassed or haven't been told that this is normal, so they don't need to bring it up, then we don't have that conversation. But now I always bring it up in my room, and I ask the question. So then when they say, oh yeah, I do have that problem, then I would say back then, well, I can send you for physical therapy and help your pelvic floor, because we know the pelvic floor muscles are very important. We actually didn't know that about 15 years ago. The pelvic floor is super important. Or I'll say, well, how about we go see my surgeon friend, the urogynecologist, and get surgery to fix this problem. So my patients, they listen, they go and see the physical therapist, they go see the surgeon, and they come back the next year and I get their feedback. And I say, so how'd it go? Did your symptoms go away? They're like, no. I didn't like physical therapy. It took too long. I didn't have time for it. I went to go get the consult for surgery, and it didn't like the potential complications of downtime. I have kids. I have work. I don't have time for surgery.
Right.
So now I'm stuck with the same problem. So I'm just going to wear a pad every single day. So when I jump, cough, and sneeze, I pee myself. It's on a pad and not on my underwear.
Or even a pillow if it gets really bad.
Right. Oh, I have a lot of stories, but
I'm sure.
it'll come up. So my practice is to fill that gap.
Yeah.
So I love women's wellness. I love helping women. I love solving problems for them. And what I discovered in this journey of wanting to help women more is that I discovered this new technology that can help women with these symptoms of bladder control. The proper term for it would be stress incontinence or some form of
Stress incontinence.
Yeah, some form of
Yes.
incontinence.
But how about for the colon? How about for the other kind of incontinence?
Actually, the pelvic floor plays a very important role when it comes to, if you want to say, fecal incontinence.
Fecal incontinence.
It actually will improve that too if we
Really?
improve the pelvic floor. So I discovered this technology. So I didn't come up with the technology. I'm not, the researcher or anything, but, I found out they exist. I don't know why it was such a big secret because I wasn't even trained about it as a resident, as an attending. I'm not sure why people don't know about it.
Who discovered it? Who came up
So
with it?
this company called InMode,
Right.
they're based out of Israel. They do many other things, a lot of it in the aesthetic medicine space. So have you ever heard of the treatment Morpheus?
Morpheus?
Yes.
No, but I remember when he was the emperor of, right.
So Morpheus 8 became a very popular treatment because Kim Kardashian did it.
Oh.
So then everybody knew about it. So
Morpheus
it's
8?
Morpheus 8. So it's radio frequency microneedling. So it does skin tightening, right? So it almost gives you like a non-surgical facelift. So everybody's doing it because now they don't have to get, surgery.
Really?
Yes.
Yes. Wait a minute. Morpheus 8.
Yeah.
But did Morpheus drink also?
I guess you can.
See, you get the pun. Morpheus 8, Peter. Morpheus 8, but did Morpheus drink? That's a joke. Oh,
So this
So
same
Kim
so this same company designed a platform for women
So
to
wait,
treat women's symptoms. So
they-
they went from treating aesthetics, doing aesthetics.
they do
to,
these facelifts?
Well, they were using this technology to help women with skin tightening.
Wow.
So now we're using that same technology. Can I say vagina on here?
You can say vagina. Yes.
In the vagina.
In the vagina.
Yes.
Same technology in the vagina.
Yes.
Folks, if you have a vagina, you've got to listen to this. Or if you know someone who has a vagina. Yeah.
So we're using this technology to treat the root cause when it comes to bladder control. We're fixing the vagina. We're making it more youthful. We're making that blood flow and that collagen present,
Wow.
making the vagina younger, so to speak. By doing that, you are now supporting their bladder. So
That's
now
right,
when you
that's
jump,
right.
cough, and sneeze, you don't pee yourself.
Wow, that is
So.
cool. I mean, you're making it younger, but not so young that when they were little, they coughed and sneezed and pooped and
Right.
Yeah,
But we're
yeah, I
giving
get it.
women their control back. So
That is so
that's just
cool.
the vagina.
Yeah.
I have another technology that will basically do you know what Kegels are?
Yes, I do.
Yeah. So contracting and strengthening your pelvic floor by doing these Kegel exercises.
Right.
But guess what?
What?
50% of women don't know how to do one.
Wow.
So if I prescribe, go home and do Kegels to fix your pelvic floor so you can control your bladder better,
Right.
I'm not doing my patient any justice because
Right.
half of them don't know how to do it.
Yeah.
But now I have this device. It's called V-Tone. So now we got the Morpheus 8V.
Morpheus. And now you have
Now I have the
Vitos?
V-Tone.
V-tone.
Yeah,
Okay.
the V-Tone that uses electrical muscle stimulation to do basically a Kegel on crack.
Kegel on crack. I'll have a Kegel on crack and a beer.
You're basically medically what we're doing is we're super maximally contracting the pelvic floor muscles to strengthen them in a very short, efficient time. These treatments take 30 minutes. People come in with they could be listening to your podcast.
They could be. They should be.
Yeah, during their 30 minutes with me,
Wow. And so you're giving them a 30-minute Kegel
basically.
on steroids.
Yeah, on steroids.
Wow. So explain what a Kegel is. How you do
So-
a Kegel? By the way,
easiest way for
Yeah.
me to explain it is if a woman decides to go to the bathroom and urinate, if you can stop your urine midstream, you're activating your pelvic floor muscles.
right.
Oftentimes, a lot of women aren't able to do that because they don't know what those muscles are. They start kind of lifting their butts up
Yeah.
and squeezing their gluteus maximus. So you're not squeezing the right muscles. And it can be taught, and that's where my physical therapist comes in. I send them to all my friends in pelvic
wow.
floor physical therapy, like teach my patient how to do a Kegel. But
Wow.
sometimes some patients, you can't teach them. It just doesn't, there's
Yeah,
that
I
connection's
get
not
it.
there.
I get it.
So they come and they do the V-tone. I'm like, listen, you are going to feel what it feels like to have your pelvic floor muscles contracted. Once you feel it, you're going to more likely be able to activate it. So then now I can treat them, but then now they're learning, and then they can go home and do proper Kegels themselves.
That is great.
So not only am I treating, I'm teaching.
Yeah.
So
It-
the
it-
technology is amazing.
It is amazing, and it should be used by more people.
Absolutely.
When I first heard Kegel,
Uh-huh.
it is Kegel, I thought it was a mispronunciation of Kegel or Kugel, which is that noodle pie that, or a noodle cake
Uh-huh.
that, as a young man growing up in a Jewish household, my grandmother and my mother used to make all the time. So it's called a Kegel. Some people say Kugel, but you're saying Kegel.
Kegel. Some people call it Kegel.
Kegel.
Kegel, Kegel.
Kegel. Because I said, what are you going to do with a noodle pie that's going to help you not urinate? I just couldn't figure that one out. So
That's why I'm talking to you as a
That's
man.
correct.
I'm teaching you. I'm hoping I'm teaching your audience.
you are.
That,
You
women are complicated. Our bodies are very complicated.
I thank God for my wife. I know that, and may the other two that I was married to live and be well. But they are complicated.
We are.
I
Our
know.
bodies are very complicated. My son asked me one time, I think this had to be like 2 years ago, so my son was 11 years old, and he knew what I did. I'm an OB/GYN, I see women. And he said to me, how come women have a women doctor and that they have to see every year? What about the men? I was like, you're right. You got me thinking. There's no like OB/GYN for men.
There is no.
Right?
No,
Like-
but there is a urologist.
There is urologists,
Yeah,
but there's
but-
no annual visit, right? Like
No,
we
no.
have women come see us annually to kind of just make sure everything is okay. I think as a urologist, you're seeing them when you have a problem. Like your primary care doctor is sending you
You're-
to see a urologist.
You're right.
Like oftentimes I was almost acting like my patient's primary care doctor because they were so used to seeing me every year.
It's true. I mean, I see my primary once a year.
And my patients, as a gynecologist, they would see me once a year, but they would also see their primary once a year.
Yeah, there is the urologist. Once you get to a certain age, though, the urologist goes, you're old, this doesn't matter, go.
Yeah.
See you.
Yeah.
But it's almost true. But in between probably 40 to 70, you got to see your urologist because your prostate.
Check your prostate.
Yeah.
Yeah.
And then after a while, as you get older, I know this sounds weird, but once you get into your 80s and 90s, the urologist may say, "You're fine." Okay. It's a real quick thing because even if you get, and correct me if I'm wrong, but I know this because of my cousin who was like a surrogate father. He got prostate cancer. He was 93 or something, and they said, "You'll outlive your cancer." That's what he was told.
Yeah. Well, I have to say I'm not a urologist, so
That's
I'm
true.
not sure
I
if that's
get
the
it. I
case.
get it.
But
Yeah.
I mean, I could see it at some point where if the cancer is slow growing
Yeah,
and
it's slow.
so.
Yeah, so that's the man thing. I want to hear more about the women thing.
Yeah. So, I mean, in my practice, I still treat women in their 80s. Women are still, there are some women out there that are still very active. But
Yes, there are.
unfortunately, their body fails them. and they
Yes.
can't do the things that they love.
And including love.
Yeah, including love, exactly. You know, the intimate wellness, the sexual wellness side, that is very important to some people.
So, what from a man's standpoint and a woman's standpoint, what is it that diminishes the desires or diminishes the
It's a
capabilities?
very good question.
Yeah, over time.
It's a very complicated answer. So let's try to piece
Yeah.
it out
Yeah,
a little
let's
bit,
do
because
it.
women
Let's
are
do
very
it.
complicated.
Right.
So let's talk about just common, okay?
Common?
Let's talk about commonly what I see.
Okay.
Okay. So I have a woman. I like to tell stories because I feel like stories are relatable.
Absolutely.
I have a woman who may be in her late 40s that will come to me and say, you know, my periods are starting to go away. I'm not getting them very often anymore. So where I'm getting at is that they're probably going to hit menopause soon.
Which means pausing from men.
I like that. I like
Yes.
that. But we don't have to. Okay, we don't have to pause from men.
Okay.
So basically, our ovaries stop working, so they're no longer producing estrogen, your hormones, right? So
Right.
you're not getting a period anymore. We now know that estrogen is a very important hormone for a lot of things. So let's talk specifically in terms of what I do. So you have a woman who you know is about to hit menopause. So she's sitting in my office. I'm having this conversation with her. I'm like, oh, these are the things that are going to happen in the next few months. Like your periods are going to stop. Your vagina might start getting drier. Your sex may be a little bit more uncomfortable, along with your hot flashes and your moodiness and all that fun stuff probably already started happening. So then they're like, oh, okay. I was like, well, you know, why don't we get ahead of the game and do something about it? A lot of women are resistant these days. They're like,
Sure.
no, it's okay. We'll wait and see what happens. Fast forward 1 year later, she comes back. One of the questions I ask as a gynecologist, along with all other questions, is, are you having sex? Is sex uncomfortable? And then oftentimes, the same cohort of women will come and say, you know, after I saw you, a few months later, my period stopped. I tried to have sex, and it was so painful. So I stopped.
Wow.
So they just think it's normal. Like everybody says, you know, at some point, sex is going to be uncomfortable because I hit menopause. But what they don't understand is that we can do something about it.
Yeah.
So
Pay attention,
because
men.
women are not being educated, therefore the husband are misunderstanding their wives. They
Yeah.
think it's them. They think, what
Yeah.
did I do? But in reality, your wife is suffering. She's in pain,
Yeah.
right? So as
This
a
is
husband,
Great knowledge.
yeah, as a husband, you should, you know, you need to be educated too, but also encourage your wife that it's okay to go seek help because help is out there. So that's the story I see a lot in their women's in their late 40s, 50s. And I would go and prescribe vaginal estrogen because that was what I had in my repertoire of things that I could do for my patients. Vaginal estrogen works, you know.
Does.
It does. It does fix the vagina. Sex becomes more comfortable. But the problem I ended up running into is that my patients will forget to use it. Or they'll
And using it meaning, is it?
it's a cream that they
cream,
have
yeah.
to use at least twice a week at night. And my patients will say, oh, I forgot it. I went away. I didn't bring it, so I didn't use it. So I told my husband, no, I can't have sex with you right now because I don't have my estrogen cream with me. Or they'll say, okay, I used it last night, but I have to wear a panty liner all day the next day because it's leaking out and it's really, I don't like it. So I'm like, okay, great. You know, vaginal estrogen I know works, but it's not the best option for some people. It works really well for some other people. So I had to go and seek other options. This brings us back to the Morpheus 8.
Morpheus 8.
The Morpheus 8.
And then he ate again, and now he's 380 pounds. But that's okay.
But the Morpheus 8V, just to, you know, that's the proper name for it.
The Morpheus 8
V. V to stand for.
Vagina.
There you go. So.
I said it, see? I said it's okay.
So, and the results are just amazing. Like I've had women come to me and say, you saved my marriage.
Wow.
Yeah.
Wow.
When someone comes to me and say that I saved their marriage, you feel pretty good.
It's great. Yeah, that is great.
Yeah.
Yeah, it's a beautiful thing.
Mm-hmm.
Saving a marriage.
Yeah.
And wait, if they use it early enough, can they be
Ex-
like 70 or 80 and say, "You won't believe this, but I'm pregnant"?
Well, unfortunately, your ovaries aren't working anymore at that point. But yeah.
Yeah. So this is very, very enlightening. It's great to know. It's
Yeah.
great to know for all the women who are watching and or listening, or both, and for the men.
Mm-hmm. Because I know that not all women are educated, so I don't expect most men to understand the female body.
No, not at all.
Yeah.
And we have this taboo about discussing those things,
Mm-hmm.
even with our partners.
Oh, yeah.
Mm-hmm. And my wife and I, she's terrific. You met her.
Mm-hmm.
She's great, and we talk about all this kind of stuff. But it's the average person that I think doesn't understand that we go through phases of life.
We do.
And it's the physicality that changes over time. And we go back, when we're born we wear diapers, and when we die we wear diapers.
And my goal is to
Do away with those diapers.
Yeah, and because the adult diaper market is huge. It's bigger than the baby diaper market.
It is?
Yeah.
Oh, wow.
It's
It
a
is.
bigger market. And when you said about fecal incontinence, right?
Sure.
A lot of those people in nursing homes are wearing diapers, not just for urinary incontinence, but for fecal incontinence because we didn't teach them how important their pelvic floor is. We should have been working those muscles way before they got to that point.
Yeah, and if you watch TV, which we assume most people do, okay, whatever, if streaming or whatever, what is one of the most frequent, this is interesting because it deals with, I'm telling you, the governor's office, I told them not to call. I'm Melissa Lee-Agawa here, and I can't believe they called. So, when you watch commercials, it is not infrequent to see ED commercials, right?
Right.
ED medic,
Yeah.
the blue pill, the green pill, the this thing, the that thing. It's a million, Roe and Hims and that. And then weight
loss is a
weight
big one
loss
too.
things, but you don't see things about vaginas.
Yes.
And you don't see things about women's health in the reproductive area.
It's like, where's the help for women?
It's not there.
And
It's
I
bizarre.
hope
It's in your office.
Yes, it is in my office, but I am a one-man team, so to speak, right now. I hope I can spread the knowledge and teach
Or a
other people.
one-woman team.
You're right. Right. But
Some of these colloquial expressions we have. Okay. Yeah. So when you're doing this, what's the first thing you tell a woman? Now, how do you get them really interested in it? Is there to get over their hesitancy?
So these are some interesting conversations that I have with my patients. So we go through the whole consultation, I evaluate their symptoms, and I make my treatment plan for them, and I present to them what the treatment plan is. And we have to talk about, unfortunately, the cost of it because insurance are not covering these.
When are the insurance companies going to get it?
I don't know. But these are medical treatments, so if you have FSA and HSA, my office will take that. We can use that.
Okay.
But insurances are not recognizing these treatments, even though we are treating urinary incontinence and vaginal pain, or the medical term dyspareunia, right? Dyspareunia. We are treating medical conditions.
Right.
Anyway, don't get me started. So,
I feel the same way.
So when I get to the cost, and I try to present to them, like, if you just maybe brew your own coffee for a year and not drink Starbucks, or maybe skip that nail manicure, pedicure session, you can afford this.
Yeah, you know
And
what?
it's gonna change the quality of your life.
You know, that is a great way of presenting.
Right. But oftentimes, you know what my patients tell me?
What?
They're like, well, I got to go home and ask my husband. I was like, but your husband is not living in your body.
That's true.
But they
you know,
have to go home and
discuss
ask
it with
their
yeah,
husbands.
Yeah. No, I get it.
I
get it.
respect that.
Yeah, sure.
And I usually respond and say, please bring your husband in. I would love to educate him how valuable this is to you and him.
It's true.
And it's going to improve your quality of life. It's going to improve your relationship with him as well.
It's great. Wow.
So you can't put a dollar sign to improving relationship and quality of life.
That's true. That's true. It's interesting because, and we talk about this a lot at home. We're all going to be dead someday.
Sure.
We don't live forever. Some of us are closer to death than others. If you look at the age range of death, not accidents and stuff like that, or who knows when you're going to die, but why not enjoy it?
Right.
Why not enjoy having a full life with your partner, okay? And being able to have sex on a regular basis,
Yeah.
right? Why not?
And I know a
get it.
lot of women in that age group, 70s and 80s, that are still having regular sex, and they are full of life when they come
that's
to
great.
my office.
Better having regular sex than irregular sex. Yeah, it's one of those things. But I get it. And we should all strive for that. And we will be striving for it.
Right, but we need to help our women.
You do.
We need to help our women because
women
there
need
are
help.
physical barriers.
Yes, there are barriers. And a healthy vagina is important. And why don't we teach that in schools and stuff? You know, think about this. We teach history, we teach economics, we teach business, we teach all kinds of stuff. But you got to go to medical school to learn about vaginas and penises and all this other stuff and problems with it and all this. Why don't we have a course on sexual health at university level?
Definitely. I have not had. I've never heard of such a thing. Like even in high school, you would have that one class on
one class.
sexual health.
Yeah, the other classes are on baking, things like that. But wait a minute, what about if you're really getting hot?
Right.
I don't understand it.
Yeah.
And why is it a taboo subject? It's like stupid.
I think there are some cultures that made it taboo. I think it also is very important for men to understand the female body, right? Because you guys have kids. You're not just going to have boys. You have daughters.
That is true.
You have daughters, right? So if you're not comfortable speaking to your daughter about their bodies, about their periods, about having sex one day, about being pregnant, then how is she going to be comfortable having that conversation
that
with
is
somebody
correct.
else?
Yeah.
Right?
What to do to avoid getting pregnant.
Yeah.
That's important. What to do if you want to get pregnant. Well, by that time, they probably know, but sometimes they don't.
Oh, yeah.
Okay.
I mean, I'm still seeing a lot of teen pregnancies.
Wow.
Oh, yeah. I mean, not in my office, but did you know I still deliver babies?
You do?
I do. I work.
I thought only Amazon does it.
the stork.
The store. Wait a minute, you still deliver babies?
I do. I work per diem part time down at Temple.
Yes.
Thought that would resonate with you.
Yes.
So I still deliver babies. So I still see, the teen pregnancies.
In North Philly?
In North Philly.
In the hospital in North
Yeah.
Philly?
Not
Yes.
the main campus anymore. They moved their whole OB/GYN department to Women's and Family off of Wyoming.
Oh, they did?
They did. So if you were pregnant and you walked into Temple Main Hospital on Broad Street, chances are you might have to get transferred to another facility
Wow.
if you need higher level of care.
I didn't know that, yeah.
Yeah.
Temple
So-
has interesting facilities. It's a good place.
Yeah,
I
yeah.
like it. Penn State, too. They have nice, great things there. Taught at Penn State
Yeah.
for years and Temple for years. So.
Mhm.
And I still do at TU.
Mhm.
So, okay, so you started your business.
Mhm.
And I have a little cheat sheet here, okay? What is the biggest misconception, and we may have touched on this, that men have about women's health?
Here's one of my favorites.
Okay.
So when they don't understand their wife, what's happening,
Right.
she may be contradicting herself in a conversation, or she's in a mood, right?
Wait, you mean women get into moods?
Yeah.
Oh.
And men will just chalk it up to she's crazy, right? She's just crazy.
Wait a minute. You really think men think that?
I do. But here's the reality.
Well, don't tell me she is crazy. Because
No. But here's the reality.
Yeah.
Our hormones.
By the way, Peter, can you answer that? Should we get that or call him, please? I'm sorry.
It's okay.
That's our next guest. Yeah.
So our hormones.
Right.
So imagine how you would feel if you were a woman. If in your younger days, your hormones all talk to each other nicely, they function properly, they told your body what it needed to do, and then sometime in your late 30s, so shortly after you go through your pregnancies and have your children, and now you think she's crazy because she's a mom, and your hormones don't work as well for you. They fluctuate so much day to day, and that is the reason why your female partner may say things that you didn't expect her to say, or be in a mood, because our hormones actually affect us a lot, not just emotionally, but also physically. So she's not crazy.
She's not crazy.
She's not
just,
crazy.
At that moment, a balance is off.
A balance is off. Our hormones are off.
It's also interesting to me when the hormones change, like in that now it's earlier than it used to be, when girls develop earlier, okay? 10, 11,
Oh, yeah.
12. And I'll never forget that there was a woman who had a daughter. We were very close. And the daughter started like acting weird.
Mm.
And then I realized that she's going through her hormonal change from being a kid to starting to become a woman.
Mm-hmm.
Is that a good way of looking at it?
Absolutely.
Okay.
Yes.
And then we would talk about it and say, I get it, it's okay. It's just, and sometimes I'll talk to people and they'll say, yeah, my daughter is, I said, wait till she's 13 or 14. Okay? Am I right?
Yeah, you're right.
And then
I'm
it'll
bracing
last
for it right now.
Yeah.
My daughter's 10.
See, you understand. And then I go, and then for a year or two, and then after that,
It
just
levels off, right? It mellows out, and
Yeah.
then you hit your late 30s,
Oh my God.
and it starts all over again.
Wow. You're hearing this, right? Yeah, you get it. So, 7 gets it. I can see she's shaking her head. But men, I don't think go. What do men go through? Yeah, from your
From a
perspe- from a hormonal perspective.
Men can have low testosterone for several reasons.
Yeah.
It could be because of stress and poor sleep. And having low testosterone can certainly affect you, affect your quality of life. Like you have no drive, your libido is gone.
Yeah.
And then you have your wife looking at you and say, what's wrong with him? Because he used to have all the energy in the world. But now what's happening? So yes, you can have also low testosterone.
Wow. Yeah. So
to
you could have been a machine,
yeah.
and now you're just a stationary old car that can't move because
Right.
you're in blocks.
And you don't know, and men also need to be educated. Hey, maybe we need to do a panel of blood work to see what's going on.
That's true. That's true.
So it affects men differently than women. For some women, that perimenopause years, which I'm talking about the late 30s to when you hit menopause being in your early 50s, a lot of it's chaos for women.
Perimenopause is getting ready to be menopausal.
Right.
It's the pre.
It's the pre, like the peri. So it's that 7 to 10 years before your period stops. That day your period stops, which is menopause. Menopause is 1 day in your life.
Wow.
That's the definition of menopause.
Really?
Yes.
It's 1 day.
1 day. After that, the period after that 1 day is called postmenopause.
Menopausal.
Yeah. So.
Wow.
Menopause is 1 day. We make such a big deal about it, but it's just 1 day. But it's everything that's around it that we need to learn.
Yeah, it is everything. And I've lived a long time, and I've seen people change and seen people really, their moods, their speech, the way they talk
They can't
to
get the
people.
words out. We can't get the words out. We have brain fog. We can't search for the words anymore, or we're word searching, or however you want to say it. But yeah, it affects us.
It does. Boy, thank God for women, because if it wasn't for women, there would be no men.
That's true.
Right?
You need us.
We do, and thank God for men. Same reason.
Right.
Okay.
So we need to help each other.
We do, and men that have the drive, okay, especially, I mean, it goes crazy once you become a teenager, a late teenager, or a mid-teenager until you're, I don't know, dead. But the drive fluctuates for men. Correct?
Oh yeah.
The drive fluctuates for women, I assume, also. Is it more evident?
It's actually the drive decreases as we get older.
Right.
Because physiologically, we start making less and less testosterone. Women have testosterone too, but at a much lower level than men. So in our teenage years, our testosterones are much higher than when we are in our 50s. So physiologically too, when we have low testosterone, we lose our drive. So this, it's not fair, right? Women oftentimes will come to my office and say, I want to feel like I'm in my 20s again. I want it, but I don't feel that I want it. Sex still feels great when I have it, but I want that time. So I start re-educating my patients in the room and say, your body is changing, and we are not made like men where their drive, most of the time, it's happening.
Right.
For us, it's not. So there's that disconnect physiologically between men and women. And I think we both need to understand that.
Yeah.
But women, we are more reactive. So if you take care of our mental health, you take care of our emotions, our hearts, we will open up to you, and that's where our drive is going to come.
Wow, that's.
And we're more, like I said, reactive.
Yeah.
Not spontaneous anymore, unfortunately.
No, I get it. And some people may not agree with me on this, but I think part of the way men react to women should be chivalrous. I believe in chivalry.
Okay.
Okay. A lot of people don't. A lot of women will say, "I'll open my own door." Okay, I'll do this. I'm an independent person, and I agree with that. I have no problem with that. But I was brought up in a household in a culture where, yes, you open the door for a woman. You help them with things. And that may seem old-fashioned, but it's just consideration to me. Okay? I believe in being considerate to people, and anybody who's in my life, whether it's a man or a woman. Okay, I believe in consideration, and and I think that that's something that people react to one way or another, physically and mentally.
Right.
You
Oh,
know?
yeah. I think people do. I don't want to speak for all of women.
No,
but
no. And I know that there are plenty of women who will say, as I said earlier, I'll get my own door. I'll close my own. I'll get that. You don't have to carry that, and so forth. But it's cultural, I think.
there's
to
definitely
what you said.
culture
Yeah.
mixed into that. But as a woman, too, you know, I am very strong-minded. I am very independent. I love my husband. But I
Your husband's great.
Thank you.
We all love your
What
husband.
episode was he on?
He was on episode 30-something, 36.
So, yeah.
He was episode 36.
Yeah,
and you're
so
episode
I have
66.
to, yeah. So I have to thank my husband for getting me on your show.
Yeah.
So,
Yeah, he was on 66,
but
36.
you know, my husband's also a gentleman, and
Yeah.
he will make sure he opens the door for me. He'll make sure when we're walking down the sidewalk that I am on the inner side and not on the
Correct.
street. And I appreciate that. I do. And I think he would also appreciate that I appreciate that. I let him do that because it makes him feel good, right? So you take
Absolutely
care of
true.
each other.
Absolutely true. You know why the men are supposed to walk on the outside when they're walking down the street with a woman, right? Because in the old days, they would throw trash out the window and garbage, and the trajectory would hit the person on the outside.
Right.
So the man would get the one who was being hit and protecting the woman.
So my husband still does that.
So do I. So do I. I'll be walking down the street with my wife, and I go, "Hold on, let me just switch sides." It's a good thing. So it's one of those things. Back to our medical discussion. It's one of those things that's inherent in a lot of men. Men are the protector in a lot of ways. Okay. Physiologically and historically. And the men are the warriors. Okay? And what do warriors do? They, except I know there's other cases, but warriors protect the brood. Okay? They protect the community. And that's one of the things that through history we've learned. And recently women have said, I can do that, and I can learn, as Maya. We had Maya Nazareth on, and she does combat sports, right? And I think that's great, because women, especially in this day and age, have to learn how to protect themselves.
Absolutely.
So
Times has
I'm
changed.
all for women in combat sports. I'm all for women learning how to protect themselves in whatever way possible. And they should, and men should support that.
Yes.
But men should also support women's health,
Yes.
the knowledge of women's bodies. And I just don't mean in a like, oh, she's got a great body, right? I mean like, let's make her healthy.
Right.
Let's make sure that her body stays in good shape and so forth. Let's make sure that she eats the right food. Okay?
Yeah.
Which my wife will say, you're not eating that today. She will tell me that.
She's
I said,
looking
"What
out
do
for
mean?" I
you.
mean, she is looking out for me, yeah. And I think it's important that we understand how diet plays into this.
Oh, yeah.
You know, how alcohol plays into it, how drugs play into it, to keep our bodies youthful, to keep our bodies healthy, and to understand what it is and how it impacts women differently than men.
We're
Am I
not
right?
made the same. We are not made the same,
We're
unfortunately.
not made the same, no.
And-
Different Lego blocks. So if you had to tell a man, as I'm looking here, what symptoms do women ignore that they shouldn't? if you had to tell a woman, stop ignoring that, what would it be?
It's a good question. A lot of women put themselves last.
Not good.
So it's not a symptom, but I guess it can be, right?
Yeah.
And they take care of everybody else first. They take care of their children, they take care of their husband, they take care of their parents, they take care of everything. And by the time it gets to them, they are exhausted and they say, forget about it. So I see that as a symptom, right?
It is a symptom.
And I think husbands or partners can encourage their wives or women to put themselves first again. Because if you are not healthy, if you are not happy, how are you going to continue to take care of everybody else? You are going to burn out. You are going to crash.
You're 100% right. My father, I may have said this on a previous show, but had an expression when I was a kid. He used to say, how was it? After me, you come first.
Mm-hmm.
And I always wondered about that. And I said, well, what's daddy mean?
Mm-hmm.
And he would say, listen, if I don't take care of myself
Mm-hmm.
first,
Mm-hmm.
how am I going to be able to take care of you?
Right.
And it's true. I love my family,
Yeah.
my son, my daughter,
Mhm.
all my grandchildren and great-grandchildren. But I gotta be the one. I'm sort of the patriarch, although my brother's older, so I guess he's the patriarch.
Yeah.
Yeah.
It's like when you are on the airplane, right? And they teach you how to put on the oxygen mask.
Right.
Who do you put it on first?
Yourself.
Yourself before your child.
Yeah. Because how are you going to take care of your child?
Right, if you can't breathe.
Yeah, if you can't breathe, which, by the way, if you have asthma, you know what that's like.
Mm-hmm.
So all these things have helped women, can help women.
Yes.
And I'm going to say that if you are watching or listening and you think about all the things that Melissa Lee-Agawa, Dr. Lee-Agawa, has talked about, you should visit her. And this is not a commercial, by the way. This is real stuff that can help you.
Mm-hmm.
Okay, and to me, okay, I think it's imperative
Mm-hmm.
that people take care of themselves.
Yes.
And that men understand women, and women understand men.
Yes.
Because men have cycles too.
Absolutely.
We don't have womenopause, but we have something else that goes on in our
Mm-hmm.
bodies. You know, we have prostate problems.
Mm-hmm.
Most men eventually will have a prostate problem.
Yeah.
Okay? And a large percentage of men will get prostate cancer.
Mm-hmm.
Okay? So you check yourself out, gentlemen, at the urologist, and women also at the urologist, but women do have that OB/GYN that they should be seeing.
Yes. They should be talking to their
once
OB.
a year,
Yeah,
minimal.
once a year.
We don't have that. Men don't have that.
Mm-mm.
We don't have no.
Yeah.
Because we don't have babies. We make babies, help
Yes.
make babies, but we
Mhm.
don't have babies because that could be painful knowing the openings that men have. But if you had to give your final word of advice, and it could be long or short,
Okay.
okay, about women's health, what would it be? I'm looking at my cheat sheet here. Like, what's the future of women's health care? I mean, that's, what do you think's going to happen?
I think a lot's going to happen in the next 10 to 15 years.
You think so?
Oh, yeah. There's a lot of research going on in the perimenopause, menopause world. You know, you said earlier, right? There's commercials for men. There's no
ED.
commercials for women. I think that's going to change.
Really?
I think we are working towards that. So, but we need everybody's support for that.
You have mine.
So,
You have mine.
my final advice is, women, we need to get educated. We need to learn about our bodies. right?
Yeah.
And then we need to advocate for ourselves.
Yeah.
Because if we don't advocate for ourselves, who's going to? We
I agree
can't
with you.
stop putting ourselves last anymore.
And men, you should advocate for not only yourself but for women.
Thank
Okay?
you.
You should. And if you're in a relationship, it's extremely important to make sure that not only you're in good shape, but your wife or your girlfriend, okay, is in good shape. Your partner is in good shape, physically and mentally, and take care of each other.
Mm-hmm. Yeah,
That's the main thing. Take
Yeah.
care of each other.
absolutely.
So we've gotten to the point where I want to know how people, and I'm sure they want to know, get in touch with you. Where's your office? How do they get there? You know, give us all
Sure.
the pertinent information.
My physical location, my office is in Springhouse, Pennsylvania, so in the Montgomery County, Ambler area, Lower Gwinnett. Beautiful office. I hope you get to visit it.
It is beautiful.
And the way I designed it was design it with you in mind. I didn't want you to walk into a sterile office. I want you to walk into an office where you felt comfortable, where you can come and have a conversation with me. Having said that, you can go on my website, graceandglowmd.com. You can get all the information
Is
on
it
there.
Grace?
Grace and A-N-D,
Okay.
Glow, Glow, MD.com.
Okay.
People often ask me how we came up with that.
Okay. How did you come up with that?
I have to give credit to my husband.
Okay.
Age with Grace, rediscover your glow.
Oh, I love that.
We put the MD there because we want to make sure people knew it was a physician-led practice.
Yeah.
But that's how we came up with it.
Wow.
Yeah, because we can age gracefully, but we want to continue our glow.
I agree with you.
Yeah.
100%.
Also, you can follow me on Instagram. I do put out a lot of educational content, but also content for your entertainment.
What's your Instagram?
Grace and Glow MD.
Oh, it's the same?
It's the same.
And can they DM you, or is there an email address?
They can DM me. You could also email hello@graceandglowmd.com.
Wow.
Yeah.
So
I'm
listen,
not hard to find. You can Google me. My kids say that all the time. Mom, I can Google you.
Yeah. By the way, and you can Google me too. Melissa, this has been great.
Yeah, thank you so much, Dan. It was a lot of fun.
Terrific.
I
Yeah.
I don't get to talk to men a lot.
Really?
No, I talk to, women a lot.
Well,
So I was
you-
actually really excited coming today. I was like, I
It's-
get to
it's
talk
great.
to a man about women's health.
And listen, I love women. I think women should have all the health advice and caring that is possible. I really do. I think, women go through a lot.
Oh, we do.
Women go through a lot.
We're still
And-
learning.
Yeah, and fortunate for me, I found a wonderful, wonderful woman who I love, and she tells me things about life, and from her perspective, that make me more aware of what women go through, and as you have today, and I want to thank you,
Yeah.
Melissa Lee-Agawa, Dr. Melissa Lee-Agawa, OB GYN.
Thank you.
So listen, folks, get a hold of Melissa, okay? And don't forget, subscribe to Digging for Gold. This
Yes.
is episode 66. Subscribe on YouTube at Dan.Goldberg, Instagram at Dan.Goldberg, and we're also on TikTok at Digging for Gold, and we're on Spotify at Digging for Gold. And remember this, use your mind. If you don't, others will. We'll see you next time on Digging for Gold.